Bactericidal concentration that kills 99.9% of an inoculum in 24 hours is termed ? Minimum bactericidal concentration, MBC. Beta-lactam antibiotics inhibit peptidoglycan synthesis by binding to proteins. Penicillin-binding proteins. Vancomycin acts on gram-positive cocci by binding to the D-ala terminus of precursor. Peptidoglycan, lipid 2. Extended-spectrum beta-lactamase ESBL genes, such as BLA-CTXM, are inhibited by clavulanic acid, but not by inhibitor. AMP-C cephalosporinase, avibactam active. Modified Hodge test has been replaced by carba-NP and MCIM for confirming _production. Carbapenemase. Plasmomycin is a next-gen that retains activity against many aminoglycoside-modifying enzymes. Aminoglycoside. Daptomycin is inactivated by surfactant, therefore it cannot be used for pneumonia. Pulmonary, lung. Time-dependent killing antibiotics, example, beta-lactams, optimize efficacy by maintaining serum levels above MIC for greater than 70% of dosing interval, 50 to 60%. AUC MIC equals 400 is the PK/PD target for therapy in serious MRSA bacteremia, vancomycin. Colistin mechanism, electrostatic displacement of lipopolysaccharide. Divalent cations, Ca2+, Mg2+. MCR1 plasmid encodes phosphoethanolamine transferase, causing high-level resistance to antibiotic. Colistin. Nitrofurantoin achieves therapeutic levels only in making it unsuitable for pyelonephritis. Urine, lower urinary tract. Linezolid thrombocytopenia risk increases when therapy exceeds days, 14 days. Tigecycline is a glycyl cycline and covers MDR gram-negatives except species, Pseudomonas aeruginosa. Fluoroquinolones inhibit DNA gyrase, gyrase and IN5, PAR-C, topoisomerase. Pheanomycin nucleus is present in class of beta-lactams, carbapenems. CRE treatment combines high-dose prolonged infusion meropenem plus colistin if isolate MIC equals 8 micrograms per milliliter. Cephalosporins lacking anaerobic coverage except cefamycin group, cefoxitin, second generation. Sulfonamides are structural analogues of propa acid, para-aminobenzoic PABA. Streptogramin combo quinupristin dalfopristin is inactive against Enterococcus species, E. faecalis. Carbapenemase KPC belongs to Ambler class serine enzymes, class A. NDM1 is a zinc-dependent Ambler class metallobeta-lactamase, class B. Ambler class D enzyme producing carbapenem resistance in Acinetobacter, OXA, name, OXA 23, or OXA 2458. SMX-TMP acts synergistically by sequential blockade of folate pathway enzymes, dihydropteroate synthase and dihydrofolate reductase. Synergy of beta-lactam and aminoglycoside in enterococcal endocarditis is lost if Enterococcus exhibits high-level ? resistance. Aminoglycoside, HLAR. Post-antibiotic effect is pronounced with stop-dependent fluoroquinolones, concentration. Macrolide resistance by methylation of 23S rRNA is mediated by gene in Staphylococci, MLSB phenotype shows clindamycin-inducible resistance detected by test, D-zone. The 2024 CLSI breakpoint for ceftriaxone susceptibility in Enterobacterales is less than equal micrograms per milliliter, 1 micrograms per milliliter. Antibiotic stewardship prospective audit and feedback should occur within #R of culture report, 48 to 72 hours. Hetero-resistant VISA, HVISA, is identified by population analysis profiling showing subpopulations growing at micrograms per milliliter vancomycin, 4 to 8. Against MDR Acinetobacter, cefiderocol utilizes Trojan horse active uptake via receptors, siderophore ferric iron. Carbapenemase inhibitor combination meropenem vaborbactam is active against class enzymes KPC. New beta-lactamase inhibitor relebactam paired with imipenem inhibits class A KPC and class AMPC. C. Time-dependent beta-lactams employ prolonged infusion of 3 to 4 hours or infusion continuous. Clostridioides difficile, first episode non-severe infection, DOC, oral, 125 mg QID times 10 days, vancomycin. AMP-C derepression in Enterobacter cloacae is induced by exposure to generation cephalosporins. Third, acetotaxime ceftriaxone. Redman syndrome during vancomycin infusion is due to non-IgE release, histamine. Aztreonam lacks gram-positive coverage but is safe in patients with hypersensitivity. Beta-lactam penicillin anaphylaxis. Fluoroquinolones prolong QT interval by blocking cardiac X-channel, HERG, KCNH2, potassium. Tedazolid requires once-daily dosing because it attains AUC-MIC greater than AX. High-dose ampicillin for susceptible Enterococcus achieves optimal Tmic when infused over 6 hours, continuous ideally. Rifampicin resistance arises from point mutation in subunit of RNA polymerase, beta, RPOB. Polymyxin B nephrotoxicity risk is lower than colistin because it is administered as form. Active, not prodrug. Beta-lactamase inhibitor, piperacillin tazobactam, retains activity against ESBL but not C producers, carbapenemase, KPC, NDM. MLSB resistance remains susceptible to non-MLS antibiotic, parentheses for MRSA bacteremia. Linezolid, daptomycin. Ampicillin sulbactam has intrinsic activity against Acinetobacter derived from sulbactam's class A action. Beta-lactamase inhibitory plus PBP1 binding. Bedaquiline inhibits mycobacterial ATP synthase. Black box warning is prolongation, QTC. Delaminid blocks mycolic acid synthesis and is metabolized by enzyme FG-diazoflavin. Nitroreductase, RV3547. New WHO all-oral MDR-TB regimen BPA-LM includes bedaquiline, predominid, linezolid, and moxifloxacin. Speak, prosody rate 10%, phenotypic DST for M. tuberculosis. Uses proportion method on LJ medium, reporting resistance at % growth. Break time 400 milliseconds, 1%. Rifabutin is preferred over rifampicin in HIV patients because it has less induction of acid isoenzyme, CYP3A4. Isoniazid prevents synthesis of mycolic acid by inhibiting enzyme INA. Enoyl ACP reductase. Pyrazinamide requires acidic pH 5.5 and is active against ARC phase bacilli. Dormant slow-growing intracellular. Aminoglycoside ototoxicity predominantly damages cochlear cells, hair. Azithromycin post-antibiotic effect and long half-life allow once-daily dosing of milligrams per kilogram in typhoid, 10 to 20 milligrams per kilogram, adult 1 gram. D-test positive isolates should be reported R to clindamycin and S2 only. Linezolid, vancomycin, gram-positive. Fluoroquinolone resistance in Salmonella typhi is predicted by nalidixic acid MIC greater than 32 micrograms per milliliter. Escape pathogens acronym includes Enterococcus faecium, Staphylococcus aureus, Klebsiella, Acinetobacter, Pseudomonas, and Enterobacter species. Meropenem steady-state concentration 8 to 12 mg per liter via CIVI, continuous infusion achieves 100%. FT Mike. Algorithm for surgical prophylaxis recommends cefazolin first dose within minute before incision. 60 minutes, up to 120 for Vanco. Vancomycin AUC-based dosing needs AUC 24/MIC 400 to 600, estimated using Bayesian software or 2.0 levels. Serum, C trough and C peak. Breakpoint for colistin by broth microdilution susceptible less than X absolute micrograms per mil, ECAST, 2 micrograms per mil. ISPD guideline for continuous ambulatory peritoneal dialysis peritonitis recommends loading intraperitoneal cefazolin plus ceftazidime for gram-positive and cover gram-negative. Nitroxaline 8-hydroxyquinoline is effective against VRE and ESBL for uncomplicated infections, UTI. Cefamycin cefoxygen resist AMP-C but induce its expression via CEF gene, AMP-C chromosomal promoter. Penicillin allergy type 1 can be evaluated by skin testing using determinants PPL, MDM, major and minor. C. difficile ribotype 027 shows resistance to fluoroquinolones due to GYR-A mutation, 382 IL. First fully oral once-daily regimen for MDR urogenital gonorrhea under trial is zoliflodacin, spiropyrimidine trione. Fidaxomicin acts by inhibiting sigma-dependent initiation of polymerase, bacterial RNA. MRSA MEK-A encodes altered PBP with low affinity to beta-lactams, PBP2A. Temocillin is stable against ESBL and AMP-C but inactive versus enzymes, carbapenemase. Cefepime AAI zidibactam is a beta-lactam enhancer and PBP2 with intrinsic activity, beta-lactamase inhibitor PBP2 binder. Azole antifungals inhibit fungal CYP51. Among bacteria, antibiotic targets CYP51 analog. None. Azoles are antifungal specific. Post-antibiotic neutropenia is common with prolonged therapy of beta-lactam drug. Piperacillin. Multidrug E. coli ST131 predominantly produces ESBL CTXM, CTXM15. US FDA warns against use of fluoroquinolone for uncomplicated sinusitis owing to disabling effects, tendinitis, neurologic. Phage therapy advantages include specificity and minimal alteration of microbiota, normal gut. Teixobactin, a novel class, binds lipid-2 and lipid-3 teichoic acid without known mechanisms. Resistance. Combination of meropenem-viborbactam susceptibility is predicted by viborbactam protecting meropenem from Class A KPC hydrolysis. Carbapenem-resistant Pseudomonas with loss of OPRD remain susceptible to group ceftalizane tazobactam. Siderophore cefiderocol shows Trojan horse uptake via receptor systems. Iron transport, TON-B. WHO AWARE classifies antibiotics. Stewardship aims abbreviated per-seg use from access group, 60%. Dalbavancin, single 1,500 mg IV dose covers acute gram-positive skin infection due to its half-life, days, 6 to 8 days. Enterococcus faecium with VAN-A gene changes D-ALA to D-ALA-D on lac-delic. Nitromidazole resistance in H. pylori commonly via mutation in RDXA encoding, ? Nitroreductase. Cefiderocol MIC testing must be performed in broth iron-depleted cation-adjusted. Mueller-Hinton. Stewardship Golden Hour for septic shock recommends broad-spectrum IV antibiotic within 1 hour. Macrolide plus beta-lactam combination in CAP covers atypicals and reduces mortality in Severity Index Class V. PSI, Pneumonia Severity Index. Ampicillin is synergistic with ceftriaxone for E. faecalis because dual PBPs, PBP2, binding. PBP3. Inoculum effect causes elevated MIC for beta-lactams and high-density infections by ESBL-producing bacilli, Enterobacterales. Cephalexin is a generation oral cephalosporin for skin UTI-susceptible pathogens. First. Carbapenem neurotoxicity, seizures, most pronounced with drug, imipenem. Concentration-dependent linezolid optic neuropathy, usually reversible if therapy 2 months. Plazomicin retains activity against RMA N7 methyltransferase, which blocks other group aminoglycosides. Beta-lactamase inhibitor zidibactam uniquely binds rather than serine site. PBP2, beta-lactam enhancer. Anti-pseudomonal penicillin BLI piperacillin tazobactam loses activity if Pseudomonas produces AMP-C, D-repressed, inducible overexpression. Synergy checkerboard FICI == indicates synergistic antibiotic combination, 0.5. Newer oral carbapenem agent under trial for ESBL UTI is tebipenem pivoxyl, tebipenem. Time to next dose adjustment of aminoglycoside once daily regimen, guided by random level X micrograms per ml at 18 hours. 1 micrograms per ml.